Hello, welcome to the PBM and Tinnitus Lab channel. I'm Dr. Katayun and this is the first session of Tinnitus video series. In this session, I will talk about definition, prevalence, and causes of tinnitus. Tinnitus is the perception of sound without external origin, and it's important to note that it isn't a disease or disorder, it's a symptom. It means that it can be associated with different underlying disorders. Not all of the tinnitus patients experience the same sound, and the tinnitus sound can vary from a person to another person. And here I mention some common tinnitus sounds. Tonal or pure tone tinnitus is a continuous or nearly continuous sound, and it's like a ringing, whistling, beeping, or hissing. Non-tonal or noise-like tinnitus is more like a noise than a distinct tone, and it's like humming, buzzing, cracking, and roaring. Pulse-type tinnitus is commonly seen in patients with circulatory disorders, and it's rhythmic and in sync with heartbeat, and it's like thumping, whooshing, and pulsing. Musical or complex tinnitus is the perception of music or melodies or voices, and usually occurs in people with hearing loss. And somatic related or temporomandibular joint related tinnitus, which often associated with body movement, and TM joint or temporomandibular joint is in front of the tragus, and tragus of the external ear, and it's a joint that connects a mandible to the other parts of skull, and its dysfunction can lead to perception of tinnitus, and it's like clicking, popping, or grinding. These were the common tinnitus sounds, and unfortunately some people perceive more than one sound. Now about the prevalence of tinnitus. Tinnitus is a highly prevalent symptom, and for example, you see in the USA its prevalence among adult population estimated at 11.2%, and in Europe 14.7%, and Africa 5.2%, and Asia 10.2%, and as I told you, it's in the adult population, prevalence in the adult population. But in Australia, the prevalence of tinnitus in the workers, not the adult population, estimated at 14.3%. You can see that it's a highly prevalent condition. So it has impacts on the normal life and quality of life. It is estimated that it affects more than 740 million adults globally, and 2.3% of the tinnitus cases suffer from severe tinnitus, which highly impact the quality of life and impair the normal life, and it's as a major problem in more than about 120 million people around the world, mostly aged 65 years or older. The causes of tinnitus can be classified as two main groups: hearing causes and non-hearing causes. About the hearing causes, you can see here the different parts of the peripheral auditory system. For example, in the external ear, the accumulation of ear wax or cerumen may lead to tinnitus. And in the middle ear, infections like otitis media and also the remodeling of the small bones in the inner ear named otosclerosis may lead to a perception of tinnitus. And also in the inner ear, the inner hair cells and outer hair cells are located in the cochlea, and outer hair cells amplify the sound, and inner hair cells transduce the sound vibrations to electrical signals. Damage to the hair cells in the inner ear may lead to tinnitus. For example, in presbycusis or aging of the inner ear, the hair cells, and also a sudden sensory neural hearing loss and noise-induced hearing loss. All of them may lead to tinnitus. And Meniere's disease, which is a balance disorder, and its characteristics are hearing loss, vertigo or dizziness, and also tinnitus. All of these disorders may cause tinnitus. From the non-hearing causes, for example, circulatory problems like hypertension, atherosclerosis, arteriovenous malformations, and vascular tumors may lead to tinnitus perception. And also some neurological or mechanical problems like, as I told you, TM joint dysfunction and neck injuries, or cervical spine disorders, and also multiple sclerosis and some other neurological disorders may lead to tinnitus perception. Some metabolic disorders may cause tinnitus, like anemia, thyroid dysfunction, and diabetes. And also some psychological or lifestyle problems like chronic stress or anxiety, depression, sleep deprivation, and fatigue or overexertion may lead to tinnitus. Some patients experience tinnitus after a tragic event, or for example, bankruptcy or emotional breakdown. And in these patients, the tinnitus started immediately after these emotional disorders, these kind of disorders. Also, some medications may cause tinnitus. As I told you, the tinnitus of my late father was because of the daily aspirin. Its main substance is salicylate, and it can induce tinnitus in some people, and also it is used for induction of tinnitus in animal models. And non-steroidal anti-inflammatory drugs and certain antibiotics like aminoglycosides can induce tinnitus, and excessive use of alcohol and caffeine may lead to tinnitus as well. Thank you for your attention. This session is up, and in the next session I will talk about the theories of tinnitus, which is a little bit tricky topic, but I try to simplify it and it can be very interesting because when I talk about the theories of tinnitus and then the mechanisms of action of photobiomodulation as my weapon against tinnitus, then you can understand the link between the two and why I think PBM is the future treatment of tinnitus. So stay tuned, and if this channel is useful for you, please introduce it to the other people and subscribe it. So thank you for your attention and have a nice time.